So, for the discussion portion of this presentation, we'll be talking about efficiency in big data in the field of oncology. It is completely essential. When researching this, we came across a lot of really good articles that kind of explained the role that big data will play when it comes to diagnostics and testing, clinical trials, identifying patients, the type of medicine and treatment that they will be receiving. Um, The co-founders of Flatiron Health were able to identify all the ways that big data can be essential in assisting oncologists everywhere. This will help again with identifying patients, their demographics, such as men and women, and ages, environments, and what factors kind of come into play as far as cancer becoming a part of their lives. Additionally, it's used in identifying patients who need it for clinical trials, as well as, again, treatment and what the best treatment is and when the best time to receive that treatment is for them. Some questions from the text that we went over were: describe the big data issues in this case. So, looking into this, the ability to keep up on patient diagnostic testing as well as increased clinical trial usage by patients. Well, that's just a very simple, plain way of saying that big data is needed in order to organize that information of who these patients are, um, what type of cancers they have, how to treat them, when the best time to treat them is, um, and the best types of diagnostic testing and clinical trials that can assist these patients. So, because these things need organization, big data can really come in and play a big role in that organization process. How does Flatiron use big data in its attempt to improve cancer treatment? Straight from Mary Caffrey, whose article we will actually be looking at, ultimately, Flatiron technology helps oncologists identify candidates for diagnostic tests that may otherwise have been missed. So, this article we were looking at and we found it. It's kind of a more positive spin on different information about Flatiron and what they kind of do, what they stand for. So, just looking through this article really quickly, it'll just show us kind of, she has the background of like where they are from, who they are, what they do, and then she kind of goes on to talk about what they do. And there's that quote that we used in our presentation. Um, Again, she just goes through. She talks about Flatiron Health and what they're being used, or how they are deciding and choosing to use big data. Now, anticipated questions that we kind of came up with. One, is big data an effective solution in treating cancer? We think it absolutely can be. If it's used the way the co-founders intend, by storing and organizing information, it will be so beneficial to oncologists everywhere. The As far as providing treatment, as well as those diagnostic tests, having that information on hand can definitely make a huge impact on Flatiron what they what they're using big data for. So, what are some other uses for big data? Well, again, from Mary Caffrey, from that same article we just took a look at in the previous slide, she says their technology also looks at how often certain tests are being ordered and what type of patient and when. So again, we talked about that kind of over in our last few slides. Instead of it just being as simple as using it to store patient information, it stores information about diagnostic tests, what kind are being ordered, so what type of tests are most frequently used, um, and what type of patient, again, looking at demographics of people as compared to what diagnostic test is used and when that test is being used. So, if there are any other questions out there that you guys may have that we didn't cover, please feel free to look or to type them up in the comments and we can respond to them, and do our best to give you the most accurate answer. Thank you guys so much for tuning in, listening to our presentation. We really appreciate it. And just for reference, here are the articles that we use for our presentation. This one was the one we looked at. Here's one from Fortune magazine. They kind of have more of a negative outlook on the idea of big iron health. They kind of go through and they talk about how it may not be as efficient as Flatiron is hoping. And again, this one is from Fortune magazine. So they did some of their own research, and it kind of just, again, talks about, it gives you a brief description on cancer, a little bit about Zach Weinberg, and how, I'm sorry, it gives you a brief description about Zach Weinberg and Nat Turner, who are co-founders of Flatiron Health. And it talks about them and what their goal is. And they're saying how their concern is longevity, etc., and so on. And as you go on to read this article, it'll tell you more about how they just don't have faith that the big data system will work. So we did try to get information from two completely different types of resources so that we were as unbiased as possible. Again, after researching, we have come to the conclusion that we think that it could absolutely be efficient if it's used the way the co-founders intend. And yeah, that's the end of our presentation, guys. Again, thank you so much. If you have any questions, leave them in the threads for us.